Hello, today I'm going to be discussing the different oxygen masks and the different flow rates that each mask have for the pediatric settings. Okay, so this is the non-rebreather mask. It has a one-way valve. If you can see, the valve is closed and one is open. This will prevent the baby from rebreathing the carbon dioxide. The flow rate is set at 10 to 12 liters per minute. The bag will not completely empty when the child inspires if the flow is set correctly. The straps go behind the ear. We just need to see for skin breakdown and dryness. Okay, so this one's a partial rebreathing mask. It's the same concept as a non-rebreathing mask. The only difference is that you have to make sure that both valves are open. The flow rate on this one remains the same, 10 to 12 liters per minute. This one provides 50 to 60% oxygen concentration, and we would also have to look for the skin breakdown since it is over their ears. This is a nasal cannula. Before we want to put it into the baby's nostrils, we need to check the nose to see there's no polyps. Okay, we would insert and make sure that the angle is facing down. Insert it. Go behind their ears. And make sure to tie it. For this mask, the flow rate goes up to 4 liters per minute. It provides 22 to 44% concentration. After putting the mask, we need to assess for breakdowns, skin breakdowns, the dryness, irritation, redness. For this one, we would want to put water-based ointment, not petroleum jelly, because it is flammable. Okay, this is a simple mask. The flow rate goes between 6 to 10 liters per minute. It provides 35 to 60% oxygen concentration. It must be fit snugly to be affected, but not so tightly that it can cause a skin breakdown. The oxygen delivery is affected by the respiratory rate, the inspiratory flow, and how well the mask fits. Here we would just make sure that we connect it and set it at the flow rate that it's ordered. Okay, so this is a Venturi mask, and I'm going to go ahead and show you how to assemble it. We need to connect the tube to the mask like this. Then we need to place the diluter, which looks like this, with the tip facing outward. The percentage on each diluter is found on the tip. For example, this one's a 31 percentage. Then we need to connect the high humidity adapter. Then we need to connect it to the oxygen tube. Yes. Okay, this is a Venturi mask, and the doctor will order the percentage rather than the liters per minute. It provides 25 to 50% oxygen. This mask allows the mixing of room air with oxygen flow. We just need to make sure that the mask fits snugly, not too tight, and we just have to assess the skin breakdown, any redness, irritation.
Okay, so this is a trach mask for pediatrics. So how we're gonna do this is the trach goes over right here where the trach tube is. You put it right there, and then make sure you put the strap around the neck. And it has to be tight enough where you can fit one finger for children. Flow rate is 10 liters per minute, and also assess skin for breakdown.
Okay, so then this is an oxygen tent. It provides high humidity environment up to 50% oxygen concentration. The oxygen levels drop once the tent is open. The linens need to be changed frequently since it is a high humidity, the sheets get damped. As you can see, since it is a closed box, children may be fearful. And then this one's an oxygen hood, which it provides 80 to 90% oxygen concentration. It is for infants only. It allows easy access to the body. As you guys can see, it does cover only the face. The flow rate is set to 10 to 15 liters per minute, and it is used for babies who can breathe on their own. They just need the little oxygen push. Also, for this one, we can use a nasal cannula instead of the hood.
Alright, so today we're going to talk about oxygen safety. So, first and foremost, place a no smoking or oxygen in use sign, just to alert other people to know so they don't have anything that would be flammable. As well as being aware of a fire extinguisher nearby if for any case you would need it as well. And also educate parents and patients about fire safety as far as hazards, flammables such as petroleum oil, alcohol containing, or acetone nearby. And also educate parents for them to be wearing cotton fabrics, so then synthetic or wool fibers at least, so that because those generate static electricity and that can also generate a fire hazard to the oxygen. As well as keep all electronics working well. Machinery such as monitors, suction machines are grounded. Tubing not kinked or on the floor because that can be a safety hazard as well.
So now we're looking at the nursing considerations for oxygen therapy. And to start off, we're always going to be checking doctor's orders. The doctor's order is going to tell you how much liters of oxygen they want and the type of oxygen mask that the doctor ordered. So we're always doing that. Another thing is that we're always going to be assessing the oxygen level, respiration, sounds. Of course, to do that, you can use pulse ox, which is going to tell you the actual level of oxygen within the patient's body. Another thing you want to look at is for skin breakdown. Always assess for skin breakdown, especially with different masks. Some are going to go over the ears, some over the neck. So you're always going to want to make sure that it's not breaking down because it can cause infection. Another thing that we want to look at is you're going to observe the patient's skin color. You're going to be noting pallor or cyanosis. You have to keep in mind when it comes to pediatrics that newborns might have blue hands and feet, which is a normal finding. So when it comes to newborns, you want to note if the cyanosis is central involving the midline, because this is a true sign of hypoxia in newborns. It might first present circumorally, meaning just around the mouth, and progress to central cyanosis. You're going to be looking for that bluish tint around the mouth. So we're also going to want to be assessing for complications of oxygen therapy, which we have atelectasis, apnea, and also oxygen toxicity.